Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Yashti Madhu and its clinical application, and we have discussed the Dravya Yashti Madhu on the basis of Gana. In that, we have covered Kanthya, Jivaniya, Sandhaniya, Varanya, and Kandulna. So, we will move towards the next one is Mutra Virajaniya. Now, you know Virajaniya Karma means to make the color proper. So, Mutra Virajaniya means when a color of urine which is normally white or yellowish or yellow and it gets changed by some means, you have to make it correct to the proper color and it is called as Mutra Virajaniya Karma. Now, in text you will find many diseases where there is change of color. For example, in Prameha they have described different types of colors of urine, Lala Meha, Kala Meha, Neela Meha, etc. I will discuss them in details when we will discuss Prameha. But in practice, the which is majorly seen change in the color of urine and it is hematuria or Sarata Mutra Pravritti. These patients are, we see it in a more quantity than other colors of urine I have hardly seen. So, in my opinion, Mutra Virajaniya Karma is required mainly when there is Saratta Mutra Pravritti or patient tells you that there is a red color urine. Now, in that case, you have to very simple thing to make the bleeding through the urine, stop the bleeding, Ratta Sambandh Karma, and Madhur Shita, Shita Virya Stambhane Himaha. So, it is directly Ratta Stambal Dravya, so Jeshtamadi is indicated. When there is Adhoga Ratta Vitta condition, where there is Pitta and Ratta Dushti, so in that case also Jeshtamadi is drug of choice because Madhur Shita are Pitta Shamak Rasavirya and Shita Virya is Ratta Stambha. So in Adhoga Ratta Pitta, when there is Saratta Mutra Pravritti, there is Yashti Madhu is drug of choice. Here, one thing is very important clinically, that when a patient comes to you and says there is a Sarata or reddish color urine, you will use Yashti Madhu. It will be, as I said, Ratta Sambhag property by Shita Virya. It will stop the bleeding also. But always remember the underlying cause of this Saratta Mutra Pravritti is to be diagnosed, and if you don't go to the underlying cause, then this may be the only Lakshanik Chikitsa using Yashti Madhu as a Ratta Stambha. So, because there are many conditions where Saratta Mutra Pravritti is not as a disease but as a symptom, and it is the only symptom in that patient's body, and underlying cause may be different, like urethral tear, ashmari which is getting friction in the mutrosrotas, sometimes tumors, mainly cancerous tumors in the mutrosrotas which get the symptom of Saratta Mutra Pravritti. I have seen the patients that there are many major diseases like these ones, like cancer, and only symptom is Saratta Mutra Pravritti. No other symptom of mutrosrotas are seen. Hence, always remember that whenever there is Saratta Mutra Pravritti, like in the symptom in the patient, use Yashti Madhu to start the treatment, no doubt about it, but always don't forget to see the underlying cause. Many a times we give the symptomatic treatment like some Yashti Madhu, and the underlying cause disease gets day by day gets exaggerated. Hence, Shitavirya Stambhane Himaha stops the bleeding, drug of choice in Saratta Mutra Pravritti, provided the other cause, underlying cause, is ruled out, or it has we have seen the other things also. So it's many a times in summer season patient get this tendency of Saradamutra Pravritti. In that case also you can use the Yashtimatu throughout the summer period. The next Gana is Shonida Sthapan. Again, almost similar work with like Mutra Vijaniya. Here only we change the color from red to proper after Rathastambha. In Shonida Sthapan, bleeding from any orifice, the same criteria, Shita Virya, Stambhana Guna, and in the case of Ratta Pitta, Pitta Ratta Drushti, so Pitta Shaman by Madhur Shiv and Ratta Stambhan by Shita Virya. So in that case, Yashtimadu is again a very good drug in Shonida Sthapan. As it is Stambhani Hima, the Shonida Sthapan karma is done internally as well as externally whenever there is the Vrana and there is Rakta Pravritti from that Vrana. The great use of Yashtimadu I have seen in the case of as a Shonida Sthapan karma when there are bleeding ulcers, whether it is gastric ulcer, peptic ulcer or ulcerative colitis, Yashtimadu with Anupangrutta or Siddhagrutta has a marvelous effect because it has got Rattastambhan guna as well as by Sandhanya karma it heals the ulcers inside the GI tract which I mentioned in the last lecture. Similar case in the case of lung when if there is some Shatarja Vrana condition, Yashtimadu is useful. Siddhagrutta or Anupangrutta is the major or very useful kalpana as far as Shonida Sthapan karma is considered. Now, as I said, some people get problem in the summer season because of the Pitta Prakriti or any other thing. Then in that case, you can start this dravya like Yashtimadu right before the summer season starts and ask the patient to continue it throughout the summer season. See, this is Swasthya Swasthya Rakshanam. Not only Dinacharya Rudacharya means Swasthya Swasthya Rakshanam, but to prevent the forthcoming disease, if the patient has a history of such a history, then you can prevent the disease by starting the treatment well before the time. So forthcoming disease can be prevented or its intensity can be controlled. So this is the peculiarity of Ayurveda Chikitsa that we can keep the patient swastha by Dinacharya Rudacharya as well as we can prevent the disease and keep the patient swastha. So this is about Mutra Virajaniya and Shonida Sthapan karma. The next two gana are very interesting and actually for that gana I have choose Yashtimadu. One is Chardi Nigrana means stops the bleeding and other is Vamnapaga means the same dravya induces the Chardi. So this is the homework for you up to next week that a same dravya acting in totally different or opposite way. One is Chardi Nigrana which stops the bleeding and other is Vamnapaga which induces the Chardi. How it will work, what is the indication, what is the contraindication, homework for you, and I will discuss these two gana which are exactly opposite in the next lecture. Thank you very much.